Good evening, everyone, and welcome to the Brian Crombie Radio Hour on Saga 960. So we're going to raise a pretty controversial issue today with Alex Vezina, the CEO of Prepared Canada, because he's recently written an article about this issue, and I want him to explain both what the issue is and what his position is. But it's interesting because there's been a lot of press about how frustrated some medical professionals have become with people that are in their ICUs and are unvaccinated. And actually, Alex, I just this morning read an article about a physician in the United States that was incredibly frustrated because he said he had something like 11 people that had passed away from COVID-19 in the past short while, all of them unvaccinated and all of them denying COVID-19 on their deathbed. So tell us, if you could, Alex, what the issue is and what your position is.
Okay, so there are a few different ways that people frame this issue, but in general, the thing that is being called for, just on the surface, is for the unvaccinated to be denied healthcare. The reason that's being given for this is because the claim is that the unvaccinated are indirectly killing people in the hospital that are getting surgeries or other treatments deferred because they're clogging up the hospital system. So as an example, or an example that's often given with this issue, you have an elective cancer surgery that is it's elective, or it's not mandatory to do right now because the person isn't going to die if they don't have the surgery right now. But if they don't get the surgery right now, their cancer may progress in 4 months to the point where there's nothing that can be done. So the surgery is needed for them to survive, but it's needed for them to survive later, not now, versus you have an unvaccinated person who ends up in some form of respiratory failure, where if they don't get treatment, they die immediately. So that's basically the way it's being viewed and framed, and essentially is the issue. And the question becomes:
unvaccinated people that get COVID-19 are taking up scarce ICU beds.
Yes, but the ICU beds are required
by someone else.
By someone else who needs a surgery, because if you don't have the ICU bed, they can't have the post-op care that they need so that the surgery doesn't have too high risk of complications. So It's a very specific issue that has a whole bunch of different perspectives.
Okay. And so what's your opinion?
So my view on this is we have ascribed to certain biomedical ethics in having a universal healthcare system. And if you deny healthcare to anyone, but if you deny healthcare to the unvaccinated, in this case, you fundamentally change medicine. And that is something that should not be taken lightly. That's the issue. And I don't think a lot of people really, well, I mean, having said that, 90+% of the feedback I got in the column was exactly right. That makes perfect sense. And every piece of feedback I've gotten from a doctor was, this is what I have been saying. But there are quite a few people who I don't think really know, or maybe they do, but there's been so much compounded stress. It's harder to really refocus on when it's such a
But a lot of people
vile example
that are maybe not calling for this, but asking about it or suggesting it, are very frustrated that these people, because of whether it's political issues or that they're living in conspiracy theory world or something.
Oh yeah, I know.
Are not taking the vaccine and therefore are causing harm to themselves and are using up scarce ICU beds.
Yeah, I know. Yeah. And you and I have talked about this at length, and you and I both have very similar opinions on the importance of making sure that the elderly survive. Like, I think that you and I, more than many people who talk in this issue, side much further with the medical system than most. But
you don't think that we should be in any way, shape, or form denying medical service to even unvaccinated people, even people that may be conspiracy theorists and have chosen not to vaccinate themselves, and so therefore effectively end up, making themselves far more vulnerable to getting COVID-19. You think they deserve just as much health care as anyone else?
Not unless we're willing to fundamentally overhaul the entire medical system, which is what you would in effect be doing.
Okay.
And what
about a triage situation? You've got one ICU bed, you got two people. One, they both got COVID-19. One that was vaccinated. And, you know, what we keep hearing is that there's like 5% or some of the people that are in ICU beds with COVID-19 are still double vaccinated. And so therefore it's still obviously possible to get COVID when you, even if you're vaccinated. But if you've got one person that's done the right thing and gotten vaccinated, and there's another person that never got vaccinated, which would you triage?
Okay. There is a difference between first and second order triage. I actually wrote a piece on this, and not a lot of people realize this. First order triage is the first sort that you do based on prognosis, and second order triage is only supposed to be done when you have everyone that has the same prognosis. And whenever you do second order triage, you run into the territory of doctors making decisions on who lives and who dies based on social factors. And it becomes very, very legally sticky. And especially in Canada, they want an AI or a process, well, not an AI, but like they want a process or a computer to do it for them, because it's morally, it gets unethical very quickly. You start having to make decisions on which gender is more important, which race is more important, which age is more important. Once you start dividing people based on social factors, a doctor starts making decisions on who is greater and lesser than.
Doesn't happen very often, right?
It doesn't happen basically ever in a modern medical system. And when it does, doctors want to be legally protected because they're choosing who lives and dies based on social factors, not based on medical status. The reality is that people with COVID, most of the time, are CTAS 1 or CTAS. I need to break this down. There's something called the Canadian Triage and Acuity Scale that breaks down how critical someone is. And there's a few other things that happen with standard of care. Someone who comes in with COVID who has failing lungs is an immediate life-threatening danger. They're the same type of person that needs emergency CPR. In virtually every triage system on the planet, they are top of the list because of the conditions of the patient. So if you override first order triage with second order triage, you have a massive problem. Just starting there. There are a few other ways to look at this, but what people aren't realizing is when you just blanket deny healthcare, you're changing your universal healthcare system and you're overriding it with a different ethical rule. And I broke down a few of those in the column.
We're chatting tonight with Alex Vezina, who is the CEO of Prepared Canada. He's recently written a column about healthcare and whether we should or could deny healthcare to people that have got COVID-19 and chose themselves individually to not get vaccinated. It's a fascinating conversation. We're going to take a break for some messages and come back more with Alex in just a minute. Stay with us. Mm-hmm. Welcome back to the Brian Crombie Radio Hour, Saga 960. We're chatting tonight with Alex Vezina. He's the CEO of Prepared Canada. He's an emergency preparedness expert. I've chatted with him a few times on COVID-19. He's recently written a column about COVID-19 patients that have chosen themselves to be unvaccinated, and do they therefore deserve the same kind of health care as anyone else? Alex, let's bring this home and make it really personal for a second. So my mom, almost 90 years old, this week was in for heart valve surgery in Ottawa, and she was there for 10 o'clock to get all prepared for a 2 o'clock surgery, and had all the didn't eat or drink for 12 hours before, and came in and got on the gown and put on the bed and all this kind of stuff and wheeled into the pre-op, I understand. And then the cardiologist came and said, we don't have enough manpower in the ICU. We've got enough to actually do the operation, but after the operation to recover, you got to go into the ICU. And because of what's going on, we don't have enough manpower and it's not safe. So I got to cancel your surgery today. And this is something she'd been waiting for a couple of months. So she said, so, what do I do? He said, go home. I says, do I come back tomorrow? Or he says, well, we'll try to get you in the next couple of weeks. But the reality is we're short staffed and I can't bump anyone else for you, so that you got to go back into the wait list. So here's someone who needs heart valve surgery. And there was room in the operating room, but there wasn't enough room in the recovery, in the critical care afterwards, the ICU, because of COVID and manpower and exhaustion, and people that are in there because 90%, 95% of them in the ICUs today with COVID chose themselves to not get vaccinated. So there was something they could do, but they didn't do it. And they're taking my mom's heart valve surgery away.
So to respond to this, I'm going to have to be brutal. Are you okay with that?
Yeah.
Okay, just making sure. Okay. Why is your mother more important than an anti-vaxxer? Other than that, other than the
She's
personal
not more
relationship.
important. She had a scheduled surgery
Okay, but why is
that
she
they
more
had to
important?
cancel on her.
No. This is important here. If the anti-vaxxer doesn't get treatment and they are in critical condition because of a respiratory failure, they will die, or they have a greater chance of dying than your mother pre-surgery. So your
So all
mother
of us that have got heart valve surgeries or cancer surgeries or whatever else that we've got have to delay it all because of these people that aren't getting vaccinated.
welcome to medicine. Okay, why is she more important? You have to have a reason to
She's my
override.
mom.
Okay, great. Now, why do all Canadians have to agree that she's more important?
Because she's my mom.
Okay, so because she's your mother, all of Canadians need to overhaul the medical system and override medical ethics and how we've designed triage. This is the problem. So we need to find out why she's more important than them, and we have to agree on it, and we have to base our medical decisions around it and roll it out everywhere.
The reality, regrettably, is that she's not more important, and that's why she was kicked out of the OR and told to go home and told that they don't know when they can reschedule her because we are overloaded in our ICUs.
Yes, but we need to look. People making this argument fundamentally have to make an argument as to why this person's more important than this person.
Well, actually, I think your column was interesting, and maybe you can expand on this because I really actually like the rationale, and I'm obviously being a little bit argumentative with you here, and personally so because of the situation that I've encountered just this week. But what you make in the article, which I think is interesting, is that with people that have got lung cancer, if they smoked, should they be not given the same kind of healthcare that someone that got lung cancer that didn't smoke gets? And similarly, what about someone that's obese or someone that's got hypertension because of their obesity? And the obesity was effectively self-inflicted because of their lack of exercise in their diet. And so I think what you point out is that there are lots of things that we do, a snowmobiler accident or a crazy skier that got into a problem. You could argue to a certain extent was self-induced or self-inflicted. So explain that to me, if you could.
Okay. So one of the arguments that people make to essentially state that anti-vaxxers are a lesser than in this context is one of health prevention and disease prevention and health promotion. So if you're not doing enough to assist the medical system with your own care, if you're making their job too hard, you are no longer entitled to medical care. So because the anti-vaxxers are so anti-medicine, they in effect are unilaterally declaring that they're not entitled to healthcare, that style of argument. The problem that you run into is there are many other conditions where the behaviors that people already do are actually more risky or arguably more risky than what anti-vaxxers are doing right now. You run into this with people who are severely obese or people who have severe hypertension issues, for example, as you brought up. You run into this with people with severe cases of COPD, chronic obstructive pulmonary disorder because of smoking, and other things because of smoking. You run into this with people whose professions are daredevils and like to jump over canyons. Like some people are riskier than anti-vaxxers to the medical system on an individual basis. And if you make the claim that if an individual does not participate in their own health prevention, disease prevention, health promotion enough, they are disqualified from medical care, then you need to, in said system, disqualify medical care for every person who's riskier than the anti-vaxxer right now. And there are a lot of unintended consequences of that I don't think people realize, number one. Number two, you run into a situation where doctors are now, or the medical system now, is in a position to deny medical care and has to think about when it wants to deny medical care instead of the general directive of universal healthcare for all. They're two completely different philosophies on how you deliver healthcare. Right now, if you go into a hospital, you get healthcare. There's no question. It doesn't matter if you just shot somebody in the parking lot. you're getting healthcare. You're getting arrested and, chained to the bed, and the police are going to be there, but you're getting healthcare. It's a completely different mindset.
Okay, so in your scenario, someone just shot someone in the parking lot,
and that's actually scenario 2. We'll get to that in a second. But yeah,
okay, both the victim and the perpetrator have been shot, and they're both in hospital. You think they both deserve equal care?
It's not. I think that's what a universal healthcare ethics system thinks. That's fundamental to universal healthcare. It's distributive justice.
What distributive justice? Explain to me what distributive justice is.
Distributive justice there's four core ethics or moral principles essentially in modern bioethics, in our types of system. Distributive justice is the idea that you allocate resources as equally as possible to everyone, so that everyone gets as close to the same level of healthcare, regardless of social status, what they did, what the reason that they got there in the first place. So this is an extreme example to illustrate the point. Paul Bernardo gets the same minimum standard of care as your mother because universal health care. Is that something we agree with? Maybe.
Okay, well, let me challenge you here for a second. And again, I actually agree with you, but I want to challenge you for the
no, and I agree with the challenge, please.
We actually don't have universal healthcare. What we have is universal healthcare insurance, and so therefore you can go to a doctor that is employed by the state in a hospital or by a hospital board funded by government, or you can go to a doctor that runs his own business out of his own office, out of his own clinic, and he charges for those services, but he's actually not an employee. And same things with hospitals. There are, as we found out in this last federal election, private hospitals in Canada, Shouldice, which with both Jack Layton and Aaron O'Toole went to, and again they get funded by the Ontario Health Insurance Plan, but they don't actually become employees. And so therefore we've got universal healthcare insurance in Canada, funded by the federal government. But a basic concept of insurance is, as the risk goes up, the person that creates that risk should pay more. And yet we don't have that in our insurance system for healthcare. We do in cars, we do in fires, we do in floods, we do in households, but we don't have it in healthcare insurance. And the argument some people have made in the past is that, maybe what you pay into insurance in, the surtax that we have to pay on our taxes every year should be higher if you choose to smoke, or if you choose to be obese, or you choose to do some risky activities, because effectively, if we really had a true insurance system, people that have more riskier lifestyle behaviors would actually pay more.
Yeah, so there's two parts there. First, and actually that was an analogy I was going to bring up. Later as well, because this is a common counterpoint to this. People spend more time shopping around for their mechanic than they do for their doctor, and people tend to do more maintenance on their car than they do on their body. And that's directly in line with what happens with car insurance, various types of automobile insurance versus how we view healthcare. So there is. So
you're saying we care more about our cars than we do.
That's an argument that comes up frequently, and I think with many people you could definitely make that case.
Maybe if we actually had insurance that was higher for people that were higher risk behaviors, we actually have people that would care a little bit more about what doctor they chose, like you used as the example with mechanic, or would take more maintenance care of their body. Maybe actually this would be the way of ensuring that people take care of themselves better.
Sure. But then, and then I have to come back to the first thing after this too. Then you're not denying medical care. And keep in mind, this is emergency medical care in an ER, right? Like, this is not an elective procedure here that we're talking about denying. We're talking about denying resuscitation. So just keep that in mind for a sec. Then you're not denying medical care to the unvaccinated. You're denying medical care or redefining medical care to people who are inherently risky and ignoring public health, which is completely different. And as illustrated in the piece, you can do that. You will be changing the medical system fundamentally, but realize you're changing the medical system fundamentally. I don't really personally have an issue with people changing any system. At a certain point, if it gets so egregious for me, I will want to move and leave said system. But I don't have an issue with it as long as the given people understand what they're doing and understand the implications.
And I think one of the big benefits of your piece and your argument is that some people want to blame the people that aren't vaccinated in this one situation, but don't use that by extension to the other arguments you've made in regards to people that smoke, people that have obese lifestyles, et cetera. And so therefore are similarly doing things that may be causing the healthcare issues. And
well,
you're
yeah,
saying
and
if we do it for COVID, we should be doing it consistently for everything else.
Right, too. Exactly. And there's two other things. First, we don't really have the same type of universal healthcare system that you're presenting from an emergency care standpoint. The reality is that if you come into an emergency room, they treat first, find health card later. So in practice, if you're bleeding on a sidewalk, you're getting healthcare. The type of healthcare
let me ask you a question then. I spoke to someone who was very senior in the COVID-19 response in the federal government, and she said that as people, we need to get everyone vaccinated to get to herd mentality. She said we go through 4 stages. The first stage is voluntary acceptance. The second stage is incentivized, that you've got to give $100 or put people in a lottery or do some of the things that we've done to try to, or the United States has done a lot more of trying to incentivize people to get the vaccine. The third stage to get even more people is you got to get mandatory, whether it be the vaccine passports that we've seen recently and or actually mandatory vaccinations, such you can't go to school or something like that unless you get vaccinated. And she said, usually you have to get to the 4th stage as well. Otherwise, you don't get enough people that actually get vaccinated. And that 4th stage is that people start to see a lot of people die. And friends and family.
We had to do it with the first vaccine in history, smallpox too. In smallpox, you held people down and put needles in their arms. Like medical paternalism 101.
Sorry, explain that.
So with smallpox vaccine, the first vaccine, it was killing so many people, and you had people that didn't want to get vaccinated because it did kill a fair percentage of people that took it. Significantly less than the number of people that died from smallpox, but it was an acceptable risk, relatively speaking, to stop it, to stop the pandemic. There were people that were forcibly inoculated during smallpox because you had to stop it. Yes. The medical paternalism has changed over the last 100 years. It used to be the idea that you could override patient autonomy in the interest of what's in their best interest was the norm. Now it's flipped, where autonomy overrides what's in the patient's best interest. So that used to be the case. In fact, right now, it is much easier to make the ethical argument, in my view, for forcible vaccination than it is for denial of healthcare. Because in one case, you have a soft paternalistic approach where you're essentially dehumanizing a person, with universal healthcare being viewed as, in Canadian culture, it's viewed as a fundamental human right. Like, I don't know how anyone could reasonably disagree with that, given the last many decades we've had with healthcare. That, I think, is a much harder argument to make than just hold them down and put a needle in their arm on public safety grounds. But you're making different arguments here. Now, do I think we should do that one? Probably not, given the Canadian values, but maybe. It depends. Like, it gets complicated. Yeah, but there's another part here that I think isn't being talked about much, that I think is really where people are getting to, which is the second point I bring up in the column. Did you want to intro it, or did you want me to go ahead and?
Sure. Tell us what it is.
Okay. So the second argument, the first one being that people don't participate in enough health prevention promotion enough, disease prevention, health promotion enough. The second argument is that someone who is an implicit danger to public safety is disqualified from healthcare or medical care. That's the second argument that's being made. So because they are a danger to society, they're not entitled to medical care, is the second argument. And I found that one, and that one's come up quite frequently. That one I found fairly interesting. So in our society, we haven't made it criminal to not get vaccinated, yet we want to deny a right from people who are not criminal while keeping that right for people who are criminal. When criminality is usually the indicator that we give to someone who is viewed as unduly dangerous to society. That I found very interesting. So before you're a criminal, you lose rights, not privileges, rights that criminals are afforded. Like, I don't see how that jives. I don't see
Based
how
on both your concept of universal health care, that you've got to give access to all.
This isn't my concept. This is first year medical ethics. Okay, like this is.
But then also the second that you think that this public safety issue shouldn't end up being an issue. Both say that we shouldn't in any way, shape, or form be negatively impacting anyone that voluntarily doesn't take the COVID-19 vaccine and gets sick and comes and crowds out others from our ICU. It's a fascinating ethical conversation. We're going to take a break and come back more with Alex in just a minute. Stay with us. Welcome back to the Brian Crombie Radio Hour on Second and 60. We're chatting tonight with Alex Vezina. He's the CEO of Prepared Canada, an emergency preparedness company. He's an expert on emergency preparedness. We've chatted a couple different times about COVID-19, and he's recently written an article, a column about some people calling for people that have not gotten the COVID-19 vaccinations to not be given the same kind of healthcare services that others have been. And Alex, I was fascinated by your example of smallpox, and back in the early 19th century, actually European nations made the smallpox vaccination mandatory, I understand, for their armies, for the poor, and then ultimately, finally, for the populace in general. And whole groups of anti-vaxxers started being created, groups of anti-vaxxers at that time. And as you say, people were forcibly, initially they lost their jobs. They were taken out of the army, or they lost their jobs if they weren't willing to get the vaccine. But ultimately, some of the poor were forced to take the vaccine. Is that where you think we may end up?
So there are two arguments that can be made for this, and they're not perfect, and they're difficult to make in a free free modern Western society. But these are the two arguments you'll probably hear. The first, and this will happen in a few months, likely, if and when it becomes necessary for these arguments to be made. And you and I both know they're already being made internally in healthcare. So the first argument is that the person themselves is a public safety risk, and whether or not they have their opinion on it is irrelevant. So the fact that they are a body that's moving around that can spread the virus is risk enough, and they need to be inoculated against the threat the same way that you need to put a fire out. So what essentially it's a depersonalizing argument where the threat is so great for public safety, your opinion is irrelevant, you're being vaccinated. So that's the first argument that's made, which is going to be a difficult argument to make with the current numbers, but they might still make it. So that's the first argument. The second argument that you could make is that, and this is going to be really interesting, people who are still of the opinion that besides the people with legitimate medical exemptions, people that are still of the opinion that getting vaccinated is a bad decision are so wrong. They aren't capable of making their own medical decisions, and thus the medical system should make it for them. So basically saying that you're an invalid if you don't come to the conclusion that this is a decision that you should be making.
But some of these people, and you've read the articles, are being influenced by QAnon, by conspiracy theories, by bad science, by social media, and then they go into the ICU and they're asking to be given, I don't know, some drug that is supposedly used for horses that someone said was good and it's never been tested or proved. So they've got more confidence and more faith in conspiracy theories they read on Facebook than on medical science.
But does that make them the same as a coma patient? Like, are they still able to make informed decisions? Bad information, yes, but are they able to make an informed decision?
Okay, so if someone comes in and wants Clorox to be poured in their veins, like at some point in time, the former president of the United States said, let's give it a shot. Do you actually give it to them? Do you give them a horse drug that's never been tested?
No. There's medical ethics for not doing something that is obviously not in the patient's best interest, and there's other medical ethics for not doing harm. So you don't just give them, bleach to drink.
Okay, so someone's in the hospital in ICU with COVID-19. Can you give them a vaccine? You'd give them other drugs. You wouldn't ask them permission before you give them the other drugs. You'd be treating them right away.
I don't think that's an appropriate question. Usually you don't give vaccines to people who have the virus in them actively. It ends up being counterproductive.
Okay.
Well, so just to backtrack that for a moment, if someone is actively infected with something, you don't vaccinate them.
Okay.
Because it makes the situation worse. It puts more strain on their immune system and they're already making antibodies because they're fighting off the virus in earnest.
We've also seen this from a class standpoint, and it happened with measles as well, I understand. In the 1960s, when the measles vaccine was prevalent, after a few years, they came to the realization in studies that the middle class and upper class were vaccinating at very high rates and the lower class was not. And it wasn't an issue of access. It was an issue of anti-vaxxers, of concern. And so therefore, one of the reasons why they made it mandatory for school kids to get vaccinated was so that the lower class would actively get vaccinated, because they weren't. And I think we're also finding that today is that there are different ethnic communities and different color communities that end up being far more resistant to the idea of getting vaccinated. And yet then the disease becomes more prevalent in those communities and mortality is increased.
Yes, but you still come back to the question does a person not have a right to refuse individual treatments in a medical system?
Okay, so you're arguing that they have a right to refuse the vaccine, and if they refuse the vaccine, they still get complete equal treatment once they go to the hospital. What about, do they have the same access to restaurants, to food courts, to sporting facilities?
So there's a difference between a privilege and a right. You could make the argument that everyone who's not vaccinated isn't entitled to have a driver's license because it's a privilege. It's not a right. So there's a very big difference here. You are not entitled to go on any specific private property other than your own.
Going to school is a right, isn't it? Not a privilege.
Is it? Can you be homeschooled? Is there alternatives? Is public schooling a right? Maybe. If it is, then yes. Right. So like this is completely different here. So ethically, you can make the argument that if a government wants to use soft paternalism and force you to get vaccinated, and if you're already doing it, then you can do this. It's sticky, but it's not unilaterally denying a fundamental right to someone. So yeah, you can deny anything that's a privilege and not a right. As a government, you can, and you can make an ethical justification for it on public safety grounds. Should you is an open debate, but you can, and it can be ethically sound. Okay,
so you're arguing, and you've made a good argument, and frankly, I completely agree with you that we should be providing equal healthcare to all, no matter what their vaccination status. So you tell me, how are we going to solve this problem? How are we going to get vaccination rates above 90%?
Okay. I wrote another piece on this months ago because I was trying to explain to everyone that this is coming with the way triage works. If we're going to keep universal healthcare, this is a problem of capacity. Period. And this is the elephant in the room that most people are still talking about, but that really isn't being talked about enough. We need more hospital capacity. We need the ability to bring more people through the system and to treat more people with our minimum standard of care. Fundamentally, if we have that, most of this is not a problem. So what are the components of healthcare capacity fundamentally? Having the building to treat them in, having the people with the skills required, and having the other materials that are there. That's basically what you need.
So billions of dollars more. We should be spending billions of dollars more to increase our hospital capacity is what you're saying.
That's one option, not necessarily. Do we have the buildings? I would say yes. If we don't have the buildings necessarily, like if we don't have, and this is all in the previous thing that I've written. If you're in a situation where you're locking down a system and you have to close schools, your schools can be retrofitted to be hospitals temporarily. If we're in a situation where we actually need the hospital capacity and everything is completely going to feces, you find a building and you make it into a hospital. Do we have the supplies? Do we have the ventilators? We can retool manufacturing. We can make the supplies. Supplies generally aren't an issue in this area if you have enough lead up time. So a lot of the cost is going to come there. The real crux of the problem ends up being, do we have the staff? It's always the staff. We have healthcare workers in all levels that are stressed and leaving, and we don't have enough people coming in to deal with the surge. So what I've been talking about is you need to find a way to take load off the system. If that means you bring in St. John Ambulance, the Red Cross, and well, in Canada's example, it'd be bringing St. John Ambulance and start training people en masse in basic life support. And you start augmenting the healthcare system with volunteers to take load off of the things that are less technically required, so that you have more nurses and doctors that are freed up to deal with the extremely complex stuff. Then you start field promoting. We do it in the developing world all the time. Emergency management goes over with agencies like Global Medic, which is based out of Toronto and is fantastic. They train the general community on how to do it because they don't have a healthcare system that can handle it. And the community starts being the healers. And you have the doctors and nurses oversee as necessary. But if you need people, you start asking for volunteers and you start packing the hospital with volunteers and you start making new hospitals out of schools. If this is a problem.
And we haven't done that so far in Canada yet.
Well, you'd see it in the news. I mean, this is declare a national emergency.
We've got the Premier of Alberta asking for the Canadian Army to help ship people out of province. That's getting damn close. Here's the difference. We're still doing what a lot of the developed world does, where we assume that the general public is incapable of handling this, and we need the people with extensive training to do this, or there'd be too many mistakes. So we're still assuming we can handle this problem. Don't worry about it. Hubris position, which may be correct. Frankly, it may be correct. And if the problem isn't as bad as people are saying, then we probably should not field promote people from the community. But if this is take a look at what's happening in Florida and Texas, and the paper this morning just had a heat map showing what the ICU bed capacities were in the southern United States versus the high vaccination rates in northern states in the United States. It's unbelievable. Where there's high vaccination rates, there's lots of ICU space. Where there's low vaccination rates, the ICUs are jam-packed full. Yeah.
I mean, I don't think anyone reasonable is really contesting that.
So
but the question is what sort of penalty do you want to do? And I think, as we've demonstrated, denying
a penalty.
Right. Sorry?
You can't have a penalty. What you're saying is
you can.
You can't have a penalty.
Well, you can have a penalty. You can't deny universal health care because it's viewed as a fundamental right. You can deny privileges, as we're already doing, and you can imprison people, make it criminal via making it mandatory and forcibly inoculate, because you're not denying a fundamental right. You still get health care if you're in jail. Like this is the point. The denying of health care is going farther than imprisoning people. Like we're skipping.
No, I understand and agree with you. But what I'm saying is, okay, so if we all decide that we're not going to deny healthcare,
sure,
what's the solution? You've got ICUs that are like in the fourth wave that's rampant in the southern United States are completely being, overfilled, overrun. And we therefore, look at Alberta and Saskatchewan in Canada, and the fact that they may have sort of delayed some critical decisions until after the federal election is mind-boggling, that they may have made bad decisions for political reasons. And I'm not suggesting they actually did, but the question is there. The fact that, you fire your higher health minister and you make big changes the day after the federal election rather than the day before the federal election is like, it's kind of interesting. But if we want to make sure this doesn't happen in Ontario and in the balance of Canada, what do we have to do?
Okay. So, I mean, to reiterate, under the assumption that your soft paternalism, the getting rid of privileges, vaccine passport doesn't work enough. So under that assumption, you're basically left with two overarching options. Option one, assume the loss, which is always a viable strategy whenever you're dealing with risk. You can assume the dead, take the hit. You can do that the same way that you can go bankrupt in business continuity. That is always a viable option. Don't want to do that. If you don't want to, you're going to be forced into a position where you are forcibly inoculating.
Okay, so go back to this COVID expert that I spoke with that I'll remain nameless, who said that the fourth stage was effectively too many people, dying, friends and family dying, that's what it takes in the end to get some people motivated enough to actually go out and get the vaccine. And she never talked about forcible vaccination. She said first was voluntary, second was incentivized, third was things like mandatory vaccinations to get into schools and passports for travel and restaurants and things like that. But the fourth stage was that people finally got vaccinated because they knew someone that passed away and they became real. It became real to them, the threat. Because too many people today, I still hear it. And I hear people still hear it today. I don't know anyone that's died. Until you actually know someone that's died, it doesn't become regrettably real enough.
I know people who hand out flyers for booster shots telling everybody that they're going to be killing us all. Like I know hardline conspiracy theorists. They don't care. If one of their friends or family members dies of COVID, it was a conspiracy and they didn't have COVID.
Well, and
okay, so like you're not reaching some people.
People are, and I think part of the problem is they're so completely captivated by their conspiracy or by their group that are talking about all these problems that to actually go and get vaccinated would be like a denial of everything they thought about for the last year and a half.
Yeah, but still, once again, fundamentally, you're going to be assuming the loss of certain people dying, or you're going to be forcibly vaccinating at the end of the day. And if you're doing it in a smaller scale, like right now, we're assuming the loss. That's what we're doing. So
if we're not willing to forcibly vaccinate, and we're not yet at herd,
focus more on not yet at in an endemic state would be the correct phrasing for that. But yes.
Okay. People that are not vaccinated are going to die. Is that not correct?
Yes. And people who are displaced by them in the medical system are also going to die. Okay. This is reality.
And so therefore you're saying because we're not willing to either deny them healthcare or forcibly vaccinate.
You can't deny them healthcare. You can't deny them healthcare without fundamentally changing Canadian healthcare.
Okay, but what you're saying is number one, because of that, because we're not willing to or able to deny healthcare to the unvaccinated because it would change universal healthcare and the ethics about the medical establishment, and none of us want to do that. And number two, we're not going to forcibly vaccinate someone because we think that's a huge invasion of their personal rights, not just an infraction, it's an invasion of their personal rights.
We're going to assume the loss of people dying.
And by definition, people are going to be dying. And so therefore the only solution is to spend billions of dollars increasing ICU capacity.
Or finding a way to increase capacity. Yes. Now, except here's the other thing, which I think is being missed here. In option one, where you deny healthcare, you're still assuming the loss and people are dying. By not considering that, people are being dehumanized. You're just picking different people to let die.
So in option one, the people that are dying are the unvaccinated. In
option three, by assuming the loss, it's distributive justice. Everybody who's accepting the risk of people dying based on who takes higher priority in an established triage system.
But because the person with COVID-19 has the respiratory problems, they're going to get the ICU space early and right away versus the cancer patient that's going to get delayed.
Yes, because the COVID-19 person with a respiratory problem has a greater chance of dying. Now, if in that situation you find out that the people with the COVID-19 respiratory problem are 80% chance of dying, and we say that everyone with a greater than 50% chance isn't worth the investment of trying to save in terms of time and resources, you can flip that. There's like color code systems where you have red, yellow, green, black. Black is they're basically you don't have the resources for it. If we denote that people are in that color zone as opposed to red zone, which is health first, then yeah, sure, they're gone because you don't have the resources. It's the same thing as if you have 10 people dying in front of you and 3 of them are unresponsive and not breathing and you're alone. You don't do CPR on them. You don't have the time. We can do that, but that we're not there.
This is a fascinating ethical question and a real question that we're all going to be faced with. We're all faced with right now. We're going to take a break for some final messages and I'm going to come back. And I got one more ethical question I got to ask Alex. Stay with us, everybody. Welcome back to the Brian Crombie Radio Hour. Having a fascinating conversation with Alex Vezina, the CEO of Prepared Canada, tonight about a column that he wrote that has gotten quite a bit of controversy, where he argued that our universal healthcare system is such and our ethical principles in the medical establishment are such that it would be completely inappropriate to deny healthcare services to people that have COVID-19 and that are unvaccinated, even if the fact that they've got COVID-19 is because they made the decision to be unvaccinated for whatever reason, because of medical reasons or religious reasons or conspiracy theory reasons or whatever the reasons are. And I think I agree with you, Alex, and I think you've made some very good, compelling arguments in that. And we also talked a little bit about how we have this problem getting to a herd immunity if people aren't willing to actually get vaccinated, and we've got this certain group that are always going to be unvaccinated, and we talked about still not forcibly vaccinating people. And so let me ask you another question, which has been bothering me. This Delta variant would appear to have come from a whole bunch of unvaccinated people. And as long as we have unvaccinated people, we're going to get new variants, and we're going to be living with COVID-19 for a long time. And we're going to have to take booster shots every year. And some of these variants might become stronger, and the booster shots might not be good, and the vaccines might not be good for them. And how are we ever going to go over this? Should we be thinking about leper colonies or something like that, where the unvaccinated go to? And effectively, if the unvaccinated aren't going to be able to be in regular society, they're not going to be able to go to hockey games or football games or restaurants or shop, malls, etc. Are we getting close to that? Is the only way to survive this and the potential for mutations to effectively exclude unvaccinated people from regular society?
No, and actually we've covered this in previous conversations. I'm going to bring something back here, do it quick because I know we're short on time. The whole world needs to be vaccinated at the same time with something that stops COVID in its tracks before it mutates and we require a new vaccine. We're not going to have the whole developing world vaccinated until probably 2023, and airports exist. This is never going to end.
This
doesn't matter. It doesn't matter. Virtually the entire medical and pharmaceutical industry have come out and said, this is the common cold now, welcome to reality, which is something I told you half a year ago. So it doesn't matter. Why you want to, okay, so here's what you do. You lock all the unvaccinated in your supposed leper colonies, and then you shut down international trade forever, and you magically, perfectly police the Canadian-American border. Good luck with that. The only way this is ending is luck. Okay.
The only way this is ending is luck.
Or the choice to accept the loss. That is what we already did with the flu and the cold, and it's something that we've already discussed in the past. Okay. The virus mutates and requires a new vaccine. Accepting that one thing, the Canadian military is currently working on a broad spectrum COVID vaccine that works on all versions of coronavirus. And if that comes out, then we cure coronaviruses, and then this doesn't. But this is going to end through scientific innovation, not through locking people up, because we need to bring in mangoes from another country. Okay, we have trade. It's getting here. Period. Stop worrying about it. Go enjoy your life.
Well, not stop worrying about it, but
really,
get your vaccines, get used to wearing masks, and get on with
do you have two
your life.
vaccines, and are you wearing a mask everywhere appropriately?
Yeah.
Okay, well then why are you still worried? You have a greater chance of
because
being
there's unvaccinated people that are out there that are going to get mutated and they're going to infect me anyway.
Do you speed? Ever?
Yes.
You have a greater chance of dying in a car. Okay, come on, put it in perspective.
Alex Vezina, CEO of Prepared Canada. Thanks for joining us. Good conversation today. Thanks.